Good morning, and welcome to a workshop on patient communications. My name is Deborah Taylor. I'm the Director of Performance Improvement at Brownville Memorial Hospital. And we're going to spend some time today working on some communication skills, talking about health literacy. So our goals today are to define health literacy. We're going to look a little bit at what is going on behind health literacy. In other words, why study and look at and learn the tools about health literacy. We're going to do a quick warm-up. Two main areas: communicating clearly with patients and helping them remember how and when to take their medication. We're going to look at the key principles and the best practices for both of those. And you're going to walk out hopefully with some skills that can help you do both of those things. We're going to do a small group exercise at the end, which involves a role play, and then we're going to do a wrap-up. Your tools, the things that you need to have brought with you today: pencil, paper, and hopefully some listening skills that we will add to. So today we're going to look at the two main areas that I mentioned: clarity of communications and giving some clarity to how and when patients take their medications. I want you to gain an understanding from the patient's point of view. The goal for them is to gain understanding. You need to understand why you're doing it, but your patients, your customers, need to walk out with a thorough and complete understanding of what you've tried to tell them. So around that and around the taking medications, you're going to get some tips and techniques and some practice. We're also going to look specifically in the medications area about the misunderstanding of instructions and the implications of those. By the way, I'm also going to refer to patients sometimes as patients, and sometimes I'm going to refer to them as consumers or customers. They're paying for a service. Sometimes in these days they're paying a lot for the service, and as such they should be able to expect a high level of service for their dollar. This isn't the day and age where you just give your doctor or your nurse a chicken in payback for their service. Now there's money involved. People are consumers now, and we need to think more about them. Yes, they may have an illness, and they always need to be treated with respect, but they're also needing and demanding service for their dollar. So a little warm-up. Okay, we're going to start with a short poem, the first stanza of a short poem. I want you to see and understand the reasons behind this workshop and behind these lessons. So I need you to really get why we're improving these communication skills, why we're trying to. And so I'm going to be reading a short stanza from a very famous poem written by a great author. Your mission is to explain the stanza. I want you to note its theme and its major subject. So I'm going to read it to you line by line, and then you can take notes if you want. It's very short. It's also very easy. This is taught by 7th grade in California. So you're going to, once again, your mission is to explain the stanza, noting its theme and its major subject. Okay, this should be really easy. You guys ready? Okay, here we go. Oh, that's just the instructions again. Fine. 'Twas brillig in the slithy toves, did gyre and gimble in the wabe. All mimsy were the borogroves, and the mome raths outgrabe. This is from a poem called Jabberwocky by Lewis Carroll. So now I'm going to give you 1 to 2 minutes to talk amongst yourselves. You may chat with each other, and I want to get a sense of what you thought this stanza meant. Okay, go. All right, you've had a couple minutes. I noticed a few, confused looks, let's say. What, it wasn't easy? I mean, I understood it. Some people understood it perfectly. So what were some of the themes? Oh, some of you want to know what a gyre and a gimbal are. Oh, others want to know what a borogrove is. Okay, that makes sense. I can explain those. What? Let's step back a bit. This might have been hard for some of you, might have been easy. What does this mean to your patient? How does this stanza relate to healthcare and healthcare communication? That's right. If you were a patient and you came from a different culture or spoke a different language, when you talk to them about diabetes or you talk to them about hypertension, this is what they may hear. They may have absolutely no clue as to what you're talking about. You could be speaking absolute jabberwocky. So look at that patient very carefully and remember this stanza and question yourself, are you speaking jabberwocky? So our goal today is, number one, recognize when the patient, your customer, has received jabberwocky, and a couple skills regarding how to fix it. What is health literacy? It's a buzz phrase that's going around. As far as I'm concerned, it is clarity of understanding. And understanding is a complete and thorough concept. So looking at diversity, what skills are required? What does someone have to understand the health message that's being delivered? We're focusing on the recipient. So the recipient needs to be able to read the way, at least the way we're providing health communication today. A patient, a customer needs to perform simple numerical tasks. There are numerical tasks involved with things like pharmaceuticals, taking medication. Patients need to comprehend medical terms and their explanations. Not always easy. We're using, excuse me, we're using big words, or if they're not big, they're difficult to understand. Ability to process multiple inputs, verbally and written. So you're hitting people with a lot of information in a very short period of time. Difficult to do. And understanding may mean that you have to gain some health knowledge. While the internet is out there today and people have access to it, that doesn't mean that they come in with health knowledge. What do these skills and these abilities depend on, though? If someone came in with all of these, what would they have? Well, they'd have to have a certain language, level of education, a particular culture, because you may not be speaking to all these cultures, learned behaviors. Now, when you go into your doctor, you may have all of that. But then also your customer may come in with a different sexual orientation. Are you considering them, along with all those basic skills? Their history and experience may be a barrier to understanding. Levels of discomfort. Some cultures and some people in general are just not comfortable around people in lab coats, people in the office environment, their religion, their beliefs, and their customs. This is not stamped on everybody's foreheads. This does not, the person doesn't come in waving a flag saying, yeah, I have all the previous skills. I have the education. I speak your language. But, by the way, my religion forbids me from making eye contact with my doctor. These are just the things that you need to at least be aware of when you are presenting or talking to your customer. And sometimes the barriers are not obvious. So take a look.
Excuse me? Hello? Hey! I'm a human being. If you don't want to help, at least say so.
Hello, I am deaf. I may have trouble comprehending you. Thank you for your consideration. Usually, I'd read your lips to understand you.
Oh.
If you like, you could let this convert your speech to text for me.
Okay. Could you tell me how to get to it?
Want to try again?
Attention passengers, all is well. Thank you.
Low power shutting down.
Oh, yay!
Attention passengers, line 4 is delayed for 1 hour. Thank you.
So let's talk about that previous slide for a sec before we go on. So what did you get from that? Show of hands, just some feedback. What were some of the barriers to understanding? And would you have known them? That's right. There's no way you would have known someone was deaf. They're not wearing a sign. If someone's blind, sometimes they have a dog, but otherwise you don't know. There are other barriers to understanding that you will not know. And so you need to find out somehow, and we do have some skills that will help you use that. So our goal is to communicate clearly with patients. Why? Why do we bother? We have 15 minutes maybe to talk to patients, to our customers. Why should we care? Well, in the long run, you're going to attain your goal of improved health. Of course, that is your goal, otherwise you wouldn't be in this business. In addition, a lot of your organizations are checking for customer satisfaction. And when you communicate clearly, you leave with a customer who has been satisfied, and they will be happier, healthier, and they will provide you with better feedback. And sometimes you're being graded on that. I've done many patient surveys, and you've got to be honest in those. A lot of patients are honest in those, and so your job may be on the line. In the long run, when you communicate clearly, all of these add up to lower costs and, yes, fewer malpractice claims. We wasted $12 billion annually because of poor communications and the related costs. That's a lot of money we could save. Any questions up till now? Notice that is a really horrible way to get feedback. Are there any questions? Who's going to have answers? Some of your patients, when you ask that question, are not going to have answers. So I'll ask it a little bit differently. Want 3 people to answer. What did you get out of the last few slides? What was the takeaway, or what were the takeaways? Okay, well, let's take a few minutes and get that kind of feedback. Okay, great. Let's talk a little bit about clear communications and start with the key principles. Clear communications is a requirement for all healthcare workers, from the person who checks the patient in or the customer in to the time that they make the follow-up appointment. Communication has to be in plain language. Now, this may be in the language of the recipient. We have to ensure that we're meeting the needs of the customer. It's not about where you went to school, how long you went to school, and how many big words you use. It's about, did you communicate, and did the audience, your customer, understand it? We need to speak with clarity and simplicity. There are some studies that call it using living room language. And we need to speak and have, the minute we walk in that room, respect for that person. We need to be respected. That's what we expect. But there needs to be an understanding that this person may come from a different culture, and they are just as valued a person as the next person and as you are. We need to make sure our message is received clearly. Again, it's not about the delivery. That means we need to listen carefully. We need to speak slowly. Once again, I'm going to keep repeating that it's not about how much you know or where you went to school or how brilliant you are. It's about whether the person is receiving the message. Check into their body language. Keep an eye on the person who is listening or supposedly listening. Have they not said a word in 5 minutes? If they haven't moved, if they haven't said a thing, then you need to stop and check for clarity. Check for understanding. Ask them to repeat back. And we'll talk about some of those skills in a little bit. So this graphic says the perfect message is the intersection between clear and concise. Is really the perfect message just clear and concise? So what would be wrong with that? Okay, so here's an example of what I think is clear and concise. What do you think is wrong with it? You have senile incipient cataracts. Oh, that's clear. Perfectly concise. What's wrong with it? Yeah, I haven't checked into my audience. I may have been absolutely, this is so precise and so concise and so medical. And yet, if I say the word senile, I may have just completely ticked off the audience. I may leave with a absolutely angry, confused, and upset patient. This customer is not going to give you good reviews, so be careful what you say. Some more best practices for clear communication. Do not assume that the patient understands what the heck you're talking about. There are 2 techniques we're going to learn a little bit more about later. One is called active listening, and one is a teach-back technique, which some of you may have heard about. And I want you to question for understanding. Stop along the way. You may get on a roll, but stop along the way and make sure that your customer understands what the heck you're saying. There's ethics involved in clear communication. There's a rightness to what we're doing. We have to consider diversity. This is not a vanilla culture with everybody coming in with the same background or the same education in the same way. We have to be sensitive to their cultures, and with your body language, you need to show that you care. If you do not care, you should not be in this business. So I am assuming you all care. There's no shaming, and there's a sincere desire to help in this business. Intelligence does not equal literacy. Your patient may come in as the most highly regarded astrophysicist in the world. Brilliant person. And she comes in and you say incipient senile cataract. And you have just offended the heck out of her. So be careful. Don't assume that the person who is brilliant and tells you they're an astrophysicist, that she is health literate. That's not a good assumption in this business to make. All right, we're going to talk a little bit about giving patients medications and giving them instructions. This is an area that is very, very confusing to some people, actually to a lot of people. With clear communication principles, again, do not assume that the patient, your customer, understands what their instructions are. They may not know why the medicine is being prescribed. You may be the follow-up nurse. The doctor has just said you need Ramiframits and you need to take it 4 times a day, and the patient may not really get what his or her diagnosis is or what these medications are going to do. They also may not understand when and how to take the medicine. It may be confusing. What not to do when they're taking the medication. Some medications are taken with water or with food, or not with water or not with food, or it's a salve or something. Who knows? They need to have it completely understood. There may be side effects. Okay, there are side effects. There are side effects to every medication. And what to do if there are side effects, when it's an issue that they need to talk to the doctor or talk to the nurse if they experience these side effects. Look over all of their medications. What should they or should they not be taking with the current medication that's being prescribed? So some best practices. You need to translate the prescription. Pictures. Pictures speak 1,000 words. Make a chart. Now, I may not understand this particular chart, but there are people in the world where this chart is the perfect tool for understanding their medications. Find out by asking questions, by getting answers, what's going to work for your customer. And then confirm understanding. Run them through a test. What is your day going to look like? When are you going to take this? How are you going to take it? What other medications are being taken? What are you doing at the time? Don't ask yes, no questions. Do you understand? Of course, they're going to say yes. And we're going to use some of the teach-back techniques that we're going to see later. And then I want you to provide some connections for them. That may be community groups. You need to find out what they are. Family members are often with your customer. There's a pharmacist. Pharmacists are great support groups for helping with medications. Make sure you give your contact information. Give them an example week, something that can be duplicated. So set up a pill caddy if they happen to have one, or have them bring one in, and show them how to administer drops and then watch them do it. Also, if you are setting up a pill caddy, make sure you tape a sample of the pill on the pill caddy. That absolutely helps. So again, make sure that your patient, your customer, is understanding what you say. So I'm going to pause here for a second and get some feedback from you. What do you think you heard about taking medication so far, and about the importance of health literacy? And we're going to talk for a second about your understanding. Okay, great. So some more things to consider when you're administering medication. Time of day. Can everybody read an analog clock and a digital clock? What do they have at home? Can they tell time? Is the patient dyslexic? Do they have problems reading numbers? So how are you going to know? And how are you going to communicate? Let's talk about that for a second. What are ways that you're going to know? And probably, what time is it? Might be a good way to start. But do you know how to take time might be a little insulting. So let's think of different ways to ensure that they can administer these drugs at the right times. Maybe a good question is, what kind of clocks do you have at home and where are they? Great question. Don't say take the little white pill or the little red pill. First of all, do you realize your patient may be colorblind? Yeah, there's that. But the little white pill, there's a lot of little white pills. And what is little? Excuse me, have your patients come in with all of their medications. That's a great first appointment task. You know what they're taking, you know what they have in their medicine cabinet, and then they can show you. Like I said before, take and tape a sample pill to their reminder card or to the pill caddy or to their schedule. This is going to help them with the identification. And speak slowly. You really, really have to do that throughout your communication. Think about what you say before you say it. We're going to talk now about one of the communication skills that I like. It's called active listening. It's about ensuring that you hear correctly what the patient is saying. I start by listening and not interrupting. I have a tendency to want to complete people's sentences, and that's bad. So when I'm doing communicating with my patients, with my customers, I absolutely make a commitment not to interrupt. I don't overtalk. I'm empathetic. The questions and paraphrasing should go together. So what I hear you saying is, it's ensuring that I'm getting it. They've just told me something. I'm going to repeat it, possibly in the form of a question, but I'm going to repeat it in a different way. I'm going to make eye contact with my customer at all times, and I don't want to use hand gestures that are going to be distracting. So I need to make sure that I have heard correctly. So I'm going to restate what my customer says. What I heard you say is, and I'm going to put it in different terms. I'm going to avoid the yes/no questions. Those are bad. And I'm going to probe. If the patient says that, no, that's not what I said, I may ask a more probing question. So tell me about a time or tell me about when, and then I am going to repeat it in another way, ensuring and confirming that I have heard correctly. Again, silence works. Let the patient speak. Then there's the teach back technique. This is about the patient, your customer, understanding what you communicated. So you're going to explain. You're going to ask the patient to feed back to you or demonstrate to you what you just said or explained. You're going to not ask those yes/no questions, because a simple "did you understand" is going to come back with a simple yes. So tell me what you understood about. And this is where the two-arrowed, the double-arrowed clarify and assess comes in. It's a feedback loop and it's an ongoing process. Tell me what you're going to tell your family about your condition. How would you demonstrate to your family when you're going to take your medication? So I want to make sure I was clear on this. So tell me what you understand. Tell me how you would explain it to your daughter. I've given you a lot to remember. So can you tell me about? So eventually you get to understanding, but this is an iterative process that may take a while. All of these things take time, but respect takes time. A few more do's and don'ts. If you need to re-explain, you're not sure that there's understanding, reteach in a different way. Use pictures if you have to. Never assume that the patient understands until they can show you. Once they show you, or they can explain it back to you and you get it, then you can accept that there's understanding. If you need to get translation or other support, family members, workers in the hospital, there are translation experts, but there may be just a need for someone from the same culture. Couple don'ts. The "do you understand" question is a no-no. Please don't give up. I know it may take a while and sometimes may be frustrating, but don't be impatient. There is a risk to your impatience. You end up with a confused, frustrated, upset, potentially a sicker patient, and errors can be made. And that's a very, very implicative result. As we saw, there's money involved, there's health involved. This is not something that you want to do. So don't give up and don't leave your patient with misunderstandings or not understandings. Okay, we're going to practice. So we're going to practice both active listening. We're going to practice the teach back role. We're going to do a role play. So the goals of this, I want you to practice the skills and the techniques that we've talked about and that have been presented. You're already in groups of tables of 6, so you're going to split up, and 3 and 3 are going to work together. There are 3 roles that you will all play at different times, don't worry. Patient role. So you are going to assume the role based on your scenario card. There's a couple of cards you're going to get, and one is going to say the patient scenario card. The nurse is going to have a goal of clearly communicating based on the scenario that you're given. So nurse, you're going to need to get the point across to the patient and ensure that you're successful. And then there's an observer for each of these groups. You're going to pay attention to the role playing, you're going to take notes, and you have a 2 stars and a wish card. Based on what you see and what you hear, you are going to give the nurse 2 stars. 2 things that the nurse did really, really well as far as communication, and 1 wish. There's 1 thing that I would like the nurse to have done differently or done better. So there are 3 rounds. Each role is rotated with each round. Round is going to last about 5 minutes each. I'm going to give you about a minute to familiarize yourself with the scenario that you're getting. I'm going to give you 3 minutes to role play this scenario and 1 minute to discuss and give the 2 stars and a wish, which is feedback. Okay, so you have done the role playing. We're going to talk about what you have learned. I'm sure I heard a lot of people talking about the hidden scenarios. I'm curious as to who found them and who didn't. What were some of the things that you really, really did well? Excellent. So you remembered the teach back to check for understanding. I didn't hear any yes/no questions, which was excellent. And I heard maybe only 1 or 2 did you understand. So those hidden challenges, were you a little surprised at them? Yeah, your patients may come in with things like dyslexia, or you may get an autistic patient. They don't have little stamps on their foreheads. You're not going to know. So what kind of challenges did you overcome? How hard was this? Some of you had trouble listening. You know a lot, so how do you not just automatically share that knowledge? So the main takeaways. You have a customer. You need to meet the needs of that customer, and it means that that customer needs to walk out with clarity of understanding. What do you do if you can't do that? You've gotten to the end of your time with that patient and that patient does not understand. What can you do? Excellent. Get help. community support group, family support, immediate follow-up appointment. If you don't have the time right then, but do not let that misunderstanding go. It has to be resolved. The challenges, I'd say time. Would you agree? Time is a huge challenge, but it can be done. You can also lessen the time with practice on this. But you can, if you know that from thorough medical records, you know your customer is coming in with some of these challenges, you make longer appointments. You ensure translators there, you ensure family member is there. You have reviewed the information ahead of time. You know what you're going into, so you can overcome the challenges. Next steps, what do you think the next steps are? Thank you. Practice. Practice on each other. Practice with your peers, practice with patients, have an observer come in and give you 3 stars, 2 stars, and a wish, tell you how you did. All right, well, I thank you for your time today. I hope this has been useful and you've gotten some skills that allow you to communicate better with your customers. I think it's an amazing set of skills that we can help our customers with. By the way, here are some references. You'll get copies of these slides. So here are some references that you can use and refer to if you need more information. All right, thank you for your time today. I greatly appreciate it.